And now, our next speaker to giving introductory remarks is Dr. Maria Freire, the President and Executive Director for the Foundation for NIH.
Good morning, everybody. I'm very, very happy to be here. As Marie said, this is the 10th anniversary, and in fact, we're here for the third Cognitive Aging Summit. And the Foundation for the NIH is very proud to have been part of this partnership since inception in 2006. And it's very rewarding, it is particularly rewarding to see that this partnership has helped expand our understanding of age-related brain and cognitive changes, and that the commitment of all of you here today of the NIH and of the McKnight Brain Foundation remains as strong today as it has been for the past 10 years. Now, as Marie said, over the next 2 days, we will hear from experts in a variety of research fields, which will contribute to what threatens and what is cognitive reserve and resiliency and how it impacts our lives. We also will hear about new approaches and new models that may lead to new scientific breakthroughs that will help address the challenges of cognitive aging. The scientific research and discovery enterprise is always much more successful when it's done collaboratively. And for us at the Foundation of NIH, it means it has to be a collaboration with scientists, with donors, with policymakers, with regulators, and importantly, of course, with patients, because we need to work together for a common goal. We know at FNIH the power of bringing multiple constituencies together in order to tackle these very, very difficult and complicated challenges. We are, for those of you who may not know, an independent foundation created by Congress. We started our work 20 years ago, and in that span of time, we've brought in over $1 billion of public support for research. We consider ourselves to be fairly nimble and creative and proactive, and we raise funds to support these kinds of challenges, to bring together research, to promote education and training, and to do events both at NIH and frankly around the world. Some of our grantees are in Africa, in Europe, and of course the majority here in the United States. Today's summit, of course, as Marie said, is made possible by the support of our partner of more than a decade, the McKnight Brain Research Foundation. And in a moment, you will hear from Dr. Lee Dockery, Chair of the Board of Trustees. But before he takes this podium, I wanted to thank Lee personally and the McKnight Brain Research Foundation for your unwavering support to this area of research. In fact, their commitment is evidenced by the support of the 2 previous summits in cognitive aging, through establishment of a research partnership in cognitive aging among the NIA, the FNIH, and the McKnight Brain Research Foundation. And this partnership has paved the way to join with the NIA for more than $34 million in grants for cognitive aging to date. So Lee, your generosity and that of your foundation is certainly very much appreciated. I would be remiss if I would be here in the podium and not thank the NIA for their leadership and their vision. Marie, our partnerships with NIA, whether it's in this space or in ADNI or in the many other workings together that we have been spectacular. So I thank the NIA for their vision, but I particularly thank all the scientists in this room to seek the understanding of cognitive aging, to help us figure out the etiology of disease and to work together for what can be catching up of what we do in cognitive aging with what could be a very long time span for us. So the brain catching up with the body. So my husband says he wants to live until he's 160. I will gladly leave way before then. But this is such an important area of research, not only for us here in the United States, but as the population ages globally. So thank you all for your commitment, and thank you all for being here today.